The presentation that I'm giving on radiomics, pathomics, and AI for predicting response to cancer therapies with the validation of clinical trial datasets touches on the work that our group has been doing over the last decade in the use of AI tools with routinely acquired data. We're talking about H&E images, we're talking about biopsies, we're talking about routine CT scans, to be able to find patterns that are associated with clinically relevant outcomes and treatment response for cancer therapies. As we all know, there really is a big void, a major unmet clinical need in our ability today to be able to predict in advance as to which patients are going to respond well to certain therapies, particularly in the context of cancer, vis-a-vis those patients who are not going to respond. And our group has been able to identify a variety of patterns that are interpretable, that are intuitive, that are connected back to the pathobiology of the disease from these routine CT scans and biopsies that actually allow us to predict in advance of treatment as to which of these patients are going to respond, which patients are not going to respond. Additionally, our group has also shown that, particularly on the CT scans, by looking at patterns, not just related to tumor size, but looking at features relating to the vasculature of the tumors, looking at changes in the twistedness of the vasculature associated with the tumor, we're actually able to monitor progress and monitor response as patients are getting multiple doses of the therapy. And it allows us essentially the ability to look at novel, new complementary biomarkers that complement the change in tumor size. One of the critical pieces that our group has actually been focusing on is thinking about translation. It's all well and good to be able to publish papers and do the research work on completed institutional data sets. But what is it that's really required to move the needle forward in terms of translation? One of the things that we have recognized that is so important is the ability to validate these tools on retrospective completed clinical trials. And so one of the things that I'm going to be talking about in this presentation is the work that our group has been doing with regard to validation of these biomarkers from biopsies as well as CT scans on completed clinical trial data sets in a blinded fashion, and really demonstrating that these tools do work on these, in the context of these completed clinical trials, which then in turn sets the stage for prospective validation studies.